Yes, good evening and welcome to the KLeFT Sunday. I am Anupama and your host. Quick intro about me. I am a data scientist by profession and I am a humanitarian by passion, and I am a mother to my 4-year-old daughter. With my co-host, Dr. Kirti. Dr. Kirti is actually working today and I think she is attending the session maybe from the hospital or probably in the car.
Hi everyone. Hi Dr. Gaurav. Welcome. Dr. Gaurav is today's hero of the day. He's doing really great job and I wanted to welcome him to the show. Today is my casualty duty and I'm speaking from my car because there is no signal in the room. So you're doing really good job. So those of you who are new, myself Dr. Kirti, I'm a radiologist by profession and I'm a humanitarian by passion, mother of 8-year-old boy, and me and Anupama, we have started this KLeFT platform together, and today's guest is Dr. Gaurav. So, yeah, Anupama, you can take it from here.
Yeah, thank you, Dr. Kirti. Dr. Gaurav. Thank you so much for joining us in this session. Welcome to our KLeFT Sunday. And first of all, I would quickly want you to introduce yourself. And first of all, since I'm not a medical person and I'm not coming in from the medical field, I want you to introduce yourself by explaining me what does interventional radiologist mean.
Hi everyone, and special thanks to Mrs. Anupama and Mrs. Rathod and Dr. Gehlot for allowing me to be a part of such a good venture. Uh, Very nice to know that so many people are, both of you have come out with such a good initiative. So very inspired actually. Yes, so as introduced already, I am an interventional radiologist. An interventional radiologist is actually a minimally invasive surgeon. So what we do is through a small pinhole either in the wrist or the groin, we can access most of your blood vessels and even other type of organs and systems, and we can treat you. We can either diagnose things which are difficult to diagnose, or we can even treat diseases without using a blade. So just to be a little more elaborate so that everyone understands what we are speaking, I'll just share a few examples. Uh, Everyone knows that if a patient comes with a heart attack, so there are two types of treatments available. One is a cardiac bypass surgery, where you have to open up his chest, the entire sternum, rib cage bone. You have to, and then repair the blood vessels. But then there's a second way to it, which is possible in many patients, where the interventional cardiologist goes through the wrist or the groin through a very small pinhole, takes special wires or catheters under X-ray vision, and goes up to the blood vessel that is blocked and opens it up through a balloon or a stent. So same ways in rest of the body we work, interventional radiologist, where the cardiologists don't. So suppose a patient comes up with a brain stroke and the blood vessel of the brain is occluded or completely closed off because of a clot. So we open it up again through a small pinhole without any blade, and the blood flow resumes, and the irreversible consequences that could have taken place don't take place. So similarly, there are almost about 256 different diseases that we treat, from giving internal chemotherapy to cancer patients to treating leg gangrene, varicose veins, and so on. So basically, it's a therapy which is minimally invasive, which is very good in terms of recovery time and cosmesis, and there's no scar. So in those terms, it's very good. So a novel upcoming field, it gets evolved every week as we speak. But yes, right now there are more than 256 diseases that we can use to diagnose or treat patients as an alternative to open surgery.
Wow, that's really new to me. But great, this is also happening in the medical field. That's amazing. So, doctor, coming in to your channel, so you have started a YouTube channel and basically empower the patient. So, can you tell me what is empower the patient and what is this channel about?
So, as we were just running in the introductory video, as people were joining in,
Yeah.
uh, right through my career, especially since I have passed post graduation and I have been working outside as a super specialist for the past 5 to 6 years, myself, and not only me, many of my colleagues are noticing a lot of problems in this medical profession which are creeping in. And the biggest one of them is there is a huge gap in terms of trust between the patients and the doctors. So gone are the days when the patient used to trust the doctor, and there used to be family doctor system, and the patient used to trust completely for their decisions. That gap keeps on increasing, and social media is doing nothing but exaggerating that gap, highlighting a few negative elements, and only causing the gap to increase. So, as shown in the video, what is happening is patients who are coming to us, they are not trusting us anymore, and because of this, many a times patients actually end up with bad consequences. Um, and it's very natural. Like the example given in the video, if you are sitting in a plane and you don't trust the pilot, you will be in anxiety all throughout the process, throughout the flight. So, when patient does not trust the doctor, he tries to find alternative sources, do window shopping, take multiple opinions, and in the end, just ends up confused and sometimes takes negative or bad decisions, which impacts the patients. And again, the doctor community is also suffering. We are hearing so many cases of medico legal negligence and doctors getting beaten up. So yes, this gap is only getting wider and wider. So something has to come up. Patients are only taking shelter of non-authentic sources like Google or paraclinical medicine people rather than the doctor's opinion. So this is what uh, motivated me to try to do my part by creating this channel and giving authentic information to patients, authentic information from articles, from our books, from years of experience, so that they have at least some source to know in a simple language what is their disease and what are the treatment options, so that when a doctor gives shares with them the same treatment, they are not apprehensive and they don't doubt it and they don't end up taking the wrong decisions, especially when the decision has to be taken as an emergency. Because if you end up with a heart attack or a stroke, you have to take the decisions within minutes. Every minute that you delay the decision, you might end up with a very bad consequence, either an irreversible paralysis or sometimes even mortality, even death. So that's why this the main motive of the channel is just to give a authentic source of information to the patients about their diseases, so they are already prepared even before emergency occurs.
Is there anything that has actually happened in your career, in your real life experience, which has actually motivated you to start this channel? I mean, if there's something like that, can you share some experience where you felt that, okay, the patient doesn't know, patient is not empowered, or patient is getting information which is not very true? There are people who patients आते होंगे आपके पास, and वो for example, as you said, कि Google पे देख के आते हैं, they see everything in Google and then they come and then they ask you. So can you share any experience which actually where you felt, and that is something which was the point where you thought कि नहीं, अब मैं ये channel शुरू करूंगा?
Yes. Uh, like I said, the contemplation of this channel or of this problem was there since past 6 years. But since the past 1 year, few incidences occurred which pushed me and triggered me to start it immediately. So uh, there was the recent. I'll share two recent experiences because of which I chose my first two videos. Right now, the main two diseases that I've covered in my channel are uterine fibroids and stroke. So, a 33-year-old lady came to me with complaints of heavy periods, lot of abdominal pain and back pain, and she wanted to conceive. She had no children yet, married lady, but she couldn't because of those fibroids. So the gynecologist did all evaluation and found out that she had huge fibroids. One was 10 centimeter and one was 13 centimeters, so larger than a football, probably, just to explain if people are non-medicos here. So uh, she was given the option. So she went to multiple doctors. She was given the options of a uterus removal by most of them, and a few doctors said we can try removing just the fibroid and not the uterus, but the scars would be huge. So if you end up pregnant, there would be a chance of uterus rupture because there are big scars on it. They might not be able to support or hold up your pregnancy growth. So she was very confused. She didn't want her uterus removed without having children. She went to alternative medicine people, Ayurveda, homeopathy, but it helped a bit with terms of the bleeding and pain, but did not really cure it. On MRI, serial MRI scans, the fibroids were only increasing. Finally, her husband somehow did some search and actually went to a gynecologist who was updated enough and pragmatic enough, so that gynecologist referred to me, and we offered the patient a treatment known as uterine artery embolization. So through a small pinhole in the wrist, we took a small wire and a tube into the blood vessels feeding her fibroids in the uterus. So, and we blocked them off with particles selectively, the fibroid arteries and not the uterus arteries. So that led to no food for the fibroids because they were not getting blood and oxygen that is required for growth. And the fibroids shrank and disappeared. So now she was symptom free, her uterus is intact, and she can even think of conceiving and having babies. So uh, that one, and then I just did a little research and talked to my colleagues in US, like all, in fact, many countries, by our Twitter platform. And I learned that there is a huge, almost 8 out of 10 women will be facing fibroids in their lifetime. And many of them who have severe symptoms will end up with a uterus removal surgery, and most of them won't even come to know of this option, not because the gynecologists don't give it, but because many gynecologists don't even have the time to get updated, because the kind of doctor patient ratio in most countries is so bad that we are very busy. It's difficult to get updated about our own profession, and what to speak of so many other novel upcoming departments.
Yeah.
So that was one episode where I thought that so many females are going to end up with a uterus removal, not even knowing that there is such a novel option which
Yeah.
can be offered. So this was just one incident, and then the second incident really shook me to the core, and when that occurred, immediately next week I launched this channel. I was not prepared. I had a plan that I'll create 20 videos and then launch it so that there is some content, but that triggered me, and I thought, no, let me just launch it and then I'll keep creating videos through the journey.
Yeah.
So uh, 60% of my work is emergency work, patients coming with bleeding or patients coming with clots and so on. So one day I was in my working in my OPD and I had about 16 biopsies lined up, heavy day. Luckily, my colleague was with me, Dr. Shashank Mishra, and we got a call from the casualty that a 24-year-old girl has come to the casualty and her right half of her body is paralyzed and she's unable to speak, which in our language is known as aphasia. So instantly we knew that it is a stroke, and left side of her brain is affected. That is why these symptoms are there. So we ordered a CT scan and a CT angiography, and we learned that actually there is a stroke in the left side of her brain, which is a small stroke. But when we did the angiography, we found that a huge blood vessel of the left side of the brain is blocked by clot. So very soon she is going to end up with a major stroke. So problem was that this girl's parents were outside somewhere in Rajasthan, and the only people accompanying her was her 21-year-old younger sister and one cousin who was probably the same age or maybe a year older. So they had to take all the decisions. And when we explained them that your sister right now has a major stroke, but it can even worsen, and so what we will do is we will just do a small procedure again through the pinhole in the wrist. We'll take a small tube and we will suck out that clot. We have a huge chance that we can reverse this and save a lot of brain. The brain that is gone, that's irreversibly damaged, but there is a huge territory which can be saved, and she has a good shot at being completely free of disability and living normally for the rest of her life. So again, uh, when some but again, this procedure is costly because the hardware itself is about 2.5 lakhs, the whole stroke kit that comes from the company to the hospital. So even if the hospital does not take any markup, the procedure charges and all inclusive go up to 3 lakhs. So of course that was a affording family, money was not an issue there. But again, that first doubt always creeps up that these people are making it an emergency just to mint money out of it.
Yeah.
So they thought a while, they talked to some family friends. Finally, they decided to not go for the procedure and they shifted her to a nursing home. Now, a nursing home does not have even a basic facility of giving an injection which can potentially make that clot melt. Forget such a kind of advanced interventional treatment, which is probably available in 10 hospitals in good states. So it's a new treatment. So there are not many interventional radiologists. So now that fear kept on creeping in me for a week. Every day I was thinking about that girl, that a 24-year-old girl, and she might end up with a paralysis of her right half of her body, might not be able to lift her arm or leg for rest of her life, maybe wheelchair bound, and may not be able to speak for the rest of her life, just because her parents weren't there and they didn't trust the doctor who were giving them genuine advice based on science, based on the CT angiography, which can be verified.
Yeah.
And suppose after 3 hours she would have even come back to me and said, okay, we realized we went to the wrong place and we want to get it done, I would have probably refused, because by that time the brain is dead. The area that I could have saved, that's already dead. So this is a decision which you have to take within minutes. Every minute the brain loses 19 lakh neurons or cells, and that's irreversible. So that was something that shook me. I actually, the first 2 days, I was partially sleepless. After that, this was the thought that was going on in my mind, that, okay, this is the problem and I'm seeing it. There was no fault of the girl or her family, because I can understand a 21-year-old girl cannot take such a major decision, because let's say it ends up bad. Let's say actually the treatment being offered, it has its own complications also. Let's say I do that operation and it bleeds. How can that young girl take the onus of that? So I understood that it was a difficult decision for her. I don't blame her. But at the same time, I thought, what is the solution for this? Patients don't know what to do, and but the consequences are irreversible and bad. So then I thought, at least if I'm not a part of the solution, then I'm definitely a part of the problem. So I thought this channel, of course, was going on in my mind. So then I thought I should launch it. And then once I launch it, I'll come out with weekly videos on each of these topics. So we have already come out with that uterine fibroids video, where we explain everything without any bias. We don't tell patients that please do embolization. We give them all the treatment options: uterus removal, fibroid removal by surgery, the uterine artery embolization thing that I offer. And there are other minimally invasive options where the patient is not even touched. Ultrasound beam from outside can burn the fibroid, known as HIFU. Very advanced, available in few places, but very good option. So, and then this second video we came out with stroke, where we are simply telling the patients that if you're seeing the following 6 signs or one of them, you rush to the hospital near you, and these are the things that are necessary in the hospital. These basic CT scan, a basic thrombolysis facility should be there. So we are telling them about all these terms, why these diseases occur and what you should do next, so that if they are know this and they are prepared, then it can save them a lot of consequences later.
Yeah, and they don't have to keep reading Google. Okay, let me just also quickly just share this video, because I have this video open. So I'm going to share this video with the participants so they get a hang of what video are you making.
When it comes to diseases leading to death, one of the most common causes in the world is stroke, ranking only second to heart disease. Watch the video till the end as we share with you various facts about stroke which can someday save a life or prevent a disability. Stroke has a huge global impact. According to the World Health Organization, 15 million people suffer from stroke worldwide each year. Of these, 5 million die and another 5 million are permanently disabled. So, how does this data impact me? One of every 6 people will suffer from stroke during their lifetime. And of every 3 people who have stroke, one will not survive, and out of the 2 remaining survivors, one will be permanently disabled. So, what is stroke and why does it occur? Stroke is an event when a person faces certain abnormal signs because of brain damage. A stroke occurs when a blood vessel in the brain ruptures and bleeds, causing the damage, or when there's a blockage in the blood supply to the brain, preventing oxygen from reaching brain tissues. How does one recognize that the person next to you has got a stroke? A simple way to remember is with the mnemonic B fast. B stands for balance. You might notice that the person is having a severe headache, dizziness, or loss of balance. E is for eyes. The vision in one or both eyes is lost or blurred. F is for face. You might notice drooping of the face towards one side, especially when the person smiles. A for arms. There may be weakness in the arms and in the feet. S stands for speech. Patient may experience slurring of speech or complete inability to speak. And T is for time. If any one or more of these signs are present, The family needs to rush to the nearest hospital with basic facilities without wasting a single moment. Why so much hurry for rushing to the hospital? Because for every minute since the stroke starts, the brain starts losing as many as 19 lakh brain cells, commonly known as neurons, and 12 kilometers of neuronal connections or circuitry. If untreated for 3 to 5 hours, a stroke may result in the loss of 1.2 billion brain neurons, which amounts to about 7,000 kilometers of brain circuitry. This results in the brain to age faster by 36 years in just a few hours' time. If there is one fact that I want to stress in this video repeated, that is the amount of potential damage that can occur every minute if we don't reach a good hospital on time. The sooner you reach a hospital, the better. Studies reveal that if the treatment begins in the first 3 hours since the onset of stroke symptoms, the chances of recovery and normal life without disability are maximum. So please understand, time is brain and each minute counts. So what to do if we see a person with these symptoms? We rush to the emergency department of the nearest medical facility, like a hospital casualty. It should have a CT or MRI scanner machine, an IV thrombolysis system, and a neurological backup. As soon as you reach the emergency, the doctor will examine the patient, the nursing staff will collect blood for some tests, and without awaiting those results, they will send the patient for a CT or a MRI scan. The CT or MRI brain scan will be done, followed by CT or MR angiography for most cases. All decisions of further treatment will be depending on it. So does prediction of the recovery. The CT or MRI report will describe how much brain damage is present and how much more is expected, whether it is an ischemic stroke due to clot in the blood vessels or whether it's an hemorrhagic stroke due to rupture of a blood vessel in the brain. To summarize, I want to leave you with the following take home points. If you get a stroke and don't act fast, there is a 70% chance that you may die or get permanently disabled. If you see anyone with BFAST symptoms, act immediately and shift the patient to the nearest medical facility. Time is brain. Every minute counts. The nearest hospital should be equipped with emergency neurology services and CT or MRI scanner facility. Based on the scan, decide if it's an ischemic or hemorrhagic stroke and further treatment will be guided accordingly. Rest of the treatment is pretty standard according to international guidelines. We'll share the guidelines of each type of stroke in upcoming videos. So please subscribe the channel and stay tuned for future videos.
Great. That was a very informative video which you've made, and I think you yourself, you are actually making the video, and you're the one who's actually even explaining in the video. That's quite an initiative. Dr. Gaurav, what are the other videos that you are planned to do, or if you have in mind, like in the coming months? What are the other topics? If you can just share some of your videos that you want to work on.
Yes, I'm going to cover mostly all of the diseases with time. First, I am including the diseases which I am an expert on, diseases for which interventional radiology is an option, especially those that are require an emergency treatment. So, leg gangrene, because most of the patients of leg gangrene end up with the amputation or legs being chopped off and are not offered options like angioplasty, which can save their legs. So, that is one. Then thyroid nodules, I'm making a video. Again, thyroid nodules is something which about 7 out of 10 people will have in their life. And most of them end up with a thyroid removal surgery, even if the nodules are benign and they are not cancerous. But there are novel alternate options, like I can just put in a needle in that nodule and burn it. You don't need to get your thyroid removed. So there are options like that. So I'm going to first include diseases where there are options of minimally invasive surgery. You don't need to get operated and you can save yourself a lot of uh, morbidity of the surgery. You can do the same treatment with less complication risk, early recovery, and no scars. So cosmetically also good. And then, but then I realized one thing that uh, today, whatever you do, whatever you want to share and give a good outreach, uh, even if it has a good content and value, it may not really spread the amount it should. So it has to have some color, flavor, and entertainment in it. Although maybe not the best thing, but that's the truth. So I'm also planning a few musicals or poetic videos where I'm going to, and that section I'm going to call as Doctor Diaries. And I'm going to share my personal experiences with a few patients in the form of a skit or a picture slideshow, and behind a poem, Hindi poem or a musical is going to run. So, in fact, I have almost completed the script and the photo shoot of first video about a young stroke patient who gets cured. So there's a lot of comedy in it. How the mother-in-law who always fights takes her daughter-in-law of stroke to the casualty on a scooter and then gets her treated in right time.
Yeah.
So even that I'm working on, so that it's again, the intent is so that people come to the educational videos. So a few videos are like this, but again, the intent is the message behind them. So that is also, those are also some of the videos besides diseases I'm going to come about. And after I finish my forte, the interventional radiology treatment part, then I'm going to approach each specialty consultants, take content from them and come out with videos about each diseases like skin diseases, heart diseases, and so on. So there's a huge list, and let's see where the channel goes.
That's exciting. In fact, you should also share all the videos on our KLeFT Facebook group. Whenever you're launching, whenever you are bringing up a new video, just share the link, and I mean, via that you'll have more subscribers, and at the same time, we'll be able to spread the word around. That will be like really helpful for us also to be informative, because when we are trying to explain someone to somebody, it is always a very good way to visualize. People understand videos, and anything that they say visually, they'll the memory, it stays in their memory. So that's a great way. So I also wanted to ask you about your hospital, the Bhaktivedanta hospital, and actually I could also see that in the video. So just tell us, what is the hospital and the institute, the research institute that you're working on, and what is the whole plan about it?
It's a very unique kind of hospital. And to be honest, I was doing very well in Delhi, where I completed my post graduation, my fellowships in various parts of intervention. And I had the good opportunity to work in Gangaram, which is one of the finest hospitals of Delhi. And I was working in a very super specialist department, even in interventional radiology, hepatobiliary and cancer intervention. And then I shifted to JP Hospital, where one of my mentors was there, and we were working and treating patients of 19 different countries who couldn't afford treatment in US or Germany, and their own countries did not have these treatments, so they were coming all the way to our hospital as medical tourists to get these treatments.
Yeah.
But when I was approached by Bhaktivedanta Hospital to come and serve there, I couldn't stop myself, because I'll explain how so this hospital is actually a charitable hospital and also a research institute, a tertiary research institute. The hospital has been conceptualized by six doctors who were on a spiritual path. So they were connected to the yeah. So they were connected to the ISKCON mission, and one of a very famous saints, a social figure and an author, Radhanath Swami, who has also written the book The Journey Home, a world famous author. He was their mentor, their guru. So all of them approached him and said that, okay, we want to serve the society as doctors because that's our profession, but we want to do it in an ethical manner.
Hmm.
And we also want to give, besides taking care of the body, we also want to give something which takes care of everything: the body, the mind, the emotional experience, as well as the spiritual self. Because of course, by their teachings, they knew that just treating the body is not complete treatment. So then, by his inspiration, they started this institute. And our institute is based on two principles. One is integrated medicine, where we offer everything, not only allopathy. Of course, all tertiary super specialties of allopathy are there, and they are the predominant mode of treatment. But besides that, we have an Ayurveda department, homeopathy department, we have yoga department, and acupuncture department. In fact, to be honest, all other alternate pathies, naturopathy, everything's there. Even cow therapy and different kinds of treatments are available. But besides these pathies which tend to the body, we have a special department called the spiritual care department, which takes care of the mental and the spiritual health.
Wow.
So uh, yeah. there are about, I think, 22 employees in that department which are taking care of the mental and spiritual health of the patients as well as the employees.
So how is that
So,
happening? Can you give an example what exactly they do in the hospital?
so, one is we give a very deep spiritual culture opportunity to the patients as well as the employees. So all are, if someone enters our hospital, right from the time a person steps in, the first thing he sees is the DT of Srila Prabhupada, the founder Acharya of ISKCON movement, and DTs of Jagannath, Baldev, Subhadra. So Krishna and Subhadra and Balram. And from that point, wherever he goes to the hospital, he will continuously hear Vedic mantras going on, especially the Hare Krishna Mahamantra throughout the hospital, whether it is the lift, whether it is the ultrasound room, whether it is the OT, everywhere this mantra is going on 24/7. So the vibrations and all that is there. But this is by default. Besides this, we involve patients in a lot of spiritual culture. So we have this Jagannath Rath festival, which is a famous festival in Odisha. So we in Jagannath Puri. So we have a cart which takes Jagannath, Baldev, and Subhadra to each patient's room, and even the casualty, even the OT, and we give the patients an opportunity to come and offer flowers to it, take some prasad, and exchange spiritual thoughts. So then we have spiritual caretakers who go to each patient and talk to them, not only about spirituality, about anything and everything that is disturbing them or they want. For example, if a spiritual caretaker may approach a patient and the patient complains that this fan is making a lot of noise, I'm very disturbed because of that. So he'll take care of it. He'll call the concerned maintenance team and take care of it. If the patient says that I just want silence, so a particular arrangement will be made so that the patient is not disturbed even by doctors on rounds if it's not necessary. So the time, a specific exclusive time will be given to the patient. But this is not it. Besides, and then we have a lot of festivals. We celebrate Janmashtami, we celebrate Govardhan Puja, and a lot of festivals. And last, we have started with a very novel concept of mental and spiritual gyms, which is open to the patients and the employees. So, these gyms are a very novel concept where a patient or an employee can register and come in on a particular day, and they can experience mindful activities. So we do a lot of activities which we are not very mindful about. In today's paced life, we sometimes even eat our food very fast and rush uh, towards our work. So they will make you do mindful breathing, mindful sleep, yoga nidra, mindful meditation. So they'll make you aware of each and everything and be grateful about each and everything which we take for granted and we do in a very rush state. And also then there are places where they can help you spiritually. There are options, and that you can do with your own freedom and with your own spiritual culture. You don't need to, I mean, if there is a Muslim patient, we offer a particular guru from that religion to come and read a Quran to the patient. If it's a Christian, but priest can come and read Bible. So it's the choice of the patient what way they want to connect. Many options are given. And finally, we have seminars like 6-day Gita course or 6-day Discover Yourself course, where patients can register and start exploring this journey of self-realization also. So that's a very unique, different side, which is optional, but yeah, that's offered to each patient.
Are these therapies that you're giving in the hospital, are they very expensive, or is it something which it can be afforded by um, people like at mass?
A very valid question, because many patients don't want to get treated in private hospitals, but because of the amount of time that an appointment is available in a general hospital or a government hospital, but they cannot afford it because the treatment costs are huge. And not only because the hospital costs are huge, but actually the hardware and equipment sometimes is very costly. For example, so our hospital is a charitable hospital. We work on two or three principles. One is our procedure costs, operational costs are very less. And second is we don't keep any markup on the pharmacy hardware that we bring in. So like the stroke kit that I mentioned, if the hospital gets it at 2 lakhs, the hospital takes a very nominal maintenance cost of the stroke kit of the hardware and gives it to the patient maybe at 2 lakhs 10,000, not at the MRP, because the MRP of that kit is almost 4.5 lakhs. So that is one thing which we are doing. But despite all these measures, despite being a charitable institute, these treatments are costly. At the end, patient has to pay a lot. So that's why there are options. One is we have a very good medical social worker who can give patients, who can complete some documentation on behalf of patient and get money from the trust and help the patient. We have a different share your care department where our trust helps the patient. But I want patients to know of one thing, one scheme where the government, state government or the central government supports their treatment in a private hospital where the government will bear the cost. Talk about my state, Maharashtra state. So in Maharashtra, there is a very good scheme which was earlier known as Rajiv Gandhi scheme, and now it's known as Mahatma Jyotiba Phule scheme, where a patient can get treated for most of these diseases in a private hospital, and the patient does not have to pay a penny. All the patient needs is a orange ration card to prove to the government that he is a needy patient and not very well affording, and a Aadhaar card for his identity. And if that is there and the disease is valid, the patient can. So we offer this. Especially many of our dialysis patients avail this facility. They cannot afford dialysis. They cannot afford permacath catheters for dialysis or fistulas. And we do all of this under this yojana, and the patient does not have to pay a penny. So, and each state has these kinds of schemes. I was talking to my colleagues, IR colleagues from various states, and I learned that each state has its schemes. And even Gangaram, where I was there, 20% of the patient population is treated for free. We used to do liver radiotherapies, internal liver radiotherapies for liver cancers, and the therapy costed about 13 lakhs per session, but this treatment was given to free for the needy population. And not one or two, it was given to 20% of the hospital patients, which amounted to, I would say, around 200 to 600 patients per day. So so many private hospitals are doing this with government aid and help, and these facilities are available in each state. Different schemes, different names, but they are available, so patients should be able to afford them.
Oh, that's also very informative. I mean, I on a generic level, it is so difficult to even get this kind of information that, oh, so much is already available by the, like, the government is also supporting so much. Great. So I have a couple of questions here. Let me just take in some questions. So someone's asking, what is the science behind chanting being played in the hospital?
So we have one of the our hospital name is Bhaktivedanta Hospital and Research Institute.
Yeah.
So whatever we are doing in the hospital, if it is not completely in the allopathy mode, then we always do some research and back it up. So this chanting, we did a randomized control trial, which is one of the methods of giving level 1 data or level 2 data in terms of scientific evidence. And
Yeah.
we treated some dialysis patients. Few of them we did not switch on this mantra, and few of them we always switched it on when they were undergoing dialysis. And we found a huge difference in the motivation and in the overall outlook of perception of the patient who is getting treated. So dialysis patients, they are very most of the times they are very dull, irritated, or demotivated, because every alternate day they have to spend almost one half of their lives in the hospital undergoing dialysis, and they know their kidneys are not going to restart. But with this chanting, we found a different outlook and a positive perception in these patients, and they were doing a lot better, even in terms of medical or physical health. When this was given, same thing went on for diabetic patients. So we almost did research for each kinds of patients, and we found that it made a huge difference even in their physical health. What to speak of their perception, their overall outlook towards life, that changed tremendously. But and psychiatric health improved, psychological health, but even physical diseases, the sugars of diabetic patient were a lot more controlled. The same thing we also did for the doctors, and we gave this Gita knowledge to endocrinologists, and we found that doctors had become better communicators to the patient, more transparent, more ethical. They were better at communication, and they were also more pragmatic and more empathetic. And this is all research. This is not something which is a personal experience. This we proved with research. So yes, so mantra meditation has made a huge difference in health of patients. That's why we keep it on 24/7, and patients are loving it, employees are loving it. We find a different atmosphere as soon as we enter the hospital.
Yeah, I completely second what you say, because even just to share, even my dad, he's a cancer patient, And from past 1.5 year, his reports have been really improving. So he is GBM, detected by GBM. And so when he was when the surgery and everything was done, and we went in for the chemo and everything, and the doctor said that in this stage, the stage where he was detected, they said that it will not he will not be in the position to survive for more than, even if like the median survival is just like what, 12 months. But now I think it's almost been a year and a half. It's a second year. And I think chanting and his entire his belief in this, in the form of, in the spiritual being, has really made a very positive effect on him. And we can see that in his reports actually. So even the doctors do ask us that what is it that, it is helping him, and what has made a difference to him. So we just tell him that okay, this is his lifestyle the whole day, this is what he is so much into spirituality, and he's just with his own way and thinking and everything. But then, yeah, even the doctors over there, they have agreed to the fact that yes, it has affected, and it is a source to make a positive change in a patient's life. That said, let me take another question where Dr. Surinder Pisal, so he's also one of our heroes, and we him as well. He's also doing a great work, and luckily he's in Mumbai too. So he has asked a question saying that could you save the young patient? Could you save the young patient of stroke? So the patient which you just explained about.
Which I mentioned. Yes. First of all, greetings, Dr. Pishal. Sir, I was attendee in in the seminar where you were hosted as a hero, and I was very inspired. At this age, the kind of contribution to the society you are making, the even your simple act of cycling, the carbon footprint you are adding to the community, very inspired, even by your parikrama movement. So to answer your question, no, the patient never ended up back, and I knew the patient would not end up back, because once that decision is taken, just going to that hospital, understanding what has occurred, and getting some formalities done takes 2 to 3 hours, and that's it. Most of the stroke patients, that is the time, that is the window period where we can reverse most of the disease and saves the brain that is about to get damaged. And the patient never came back. So I don't even know what happened next. I was just praying since then that some neuroplasticity occurs and rest of the brain that was normal takes up the functions, and she does not end up with a major disability. And so I couldn't. But uh, on the positive side, we had the opportunity to do mechanical thrombectomy, this procedure that I was talking about for stroke, for almost about now I think 20 patients in the last 1 year or so. I think I'm in Bhaktivedanta from 1 year 4 months, so we did it for 20 patients or more, out of which about 4 patients were less than 33 years old, very young, 32, 28, and almost all 20 patients are doing well. Most of the patients, about 60% of my patients, could stand, sit, and talk next day of the treatment, sometimes even immediately after treatment. But by 3 months, most of the patients with physiotherapy and with uh, speech therapy, they could do well. So I can see your message in the chat that so sorry to disappoint me.
Yeah.
I understand it. It
Wait,
is very disappointing.
let me just unmute Dr. Surinder Pisal and he can
Yes,
express.
yes.
You asked a question, right? You asked a question.
Yeah, I was thinking of writing stories on medical kind of experiences which really change the whole outcome of the disease. So in that particular case, I was thinking this could have been a place where you don't expect or you expect something worse will happen. But then you do some such kind of a small procedure like what doctor has told us in interventional uh, uh, radiology, and remove that particular clog off, thrombus off the artery, and his whole consequences of infarct or whatever ischemia which has happened will be reversed back. If that could have happened with that particular patient, that could have been really a great surprise to me, and I would have been very happy for the patient. And that is why I was thinking, I wish with the effort of Dr. Uh, Gangwani, that could have taken place, and patient would have thanked him such a great thing has been done. Of course, the financial constraint or maybe the situational constraint has could not save a young patient. I'm really sorry for that.
Yeah. But and I think that was a moment for Dr. Gaurav where he stopped everything he thought, and he took this as an initiative.
Very true. I mean, in this particular reference, that kind of a desire probably every real doctor would have in his mind, because we know the education of patient towards awareness of the disease can change the outcome of the disease altogether. And in that reference, I had written a column. I used to write a column in Marathi newspaper that is Azaracho Ganit, in the mathematics of the illness. And as a pathologist, I used to explain how disease happens and how it is to be taken care of. But again, as Dr. Gaurav has mentioned, the reach of such kind of information to the people is very, very small.
Thanks, Dr. Surinder, for sharing.
Small comment in the chat box where someone suggested that with the good intention, of course, to use clickbait to show thumbnails of maybe actors so that people click on the video. But of course, with the intent that the outreach increases and this information reaches masses, I'll just reply that, of course, with a good intention, something even a little tricky may be okay. But I don't know. I may not be able to do that because uh, see, target audiences are different. Someone who is looking for pure entertainment, uh, they may not be happy if the content is completely different. It is educational and health. That person may, of course, health is something which everyone needs, and if given this information, it will help anyone and everyone. There is no target audience for this. Everyone should know this. But yes, if a person is not looking for it, he may not end up watching it. So plus it's not the right thing. See, we are starting a path of integrity. Even if it reaches less, that's fine, rather than reaching more in the wrong way. And just a technical part, even the YouTube algorithm is such that if someone goes on that but doesn't watch it for long, the audience retention is not good because you are reaching non-target audiences. It won't spread. So uh, that's why won't be able to do that. But yes, thank you for the suggestion. Sometimes small tricks to for a good cause can be okay.
Yeah, but I would
Yes, sir.
suggest over here that you should do that, right? Because um, when there are people who are actually spreading a lot of negative content, so you actually working in for something which is really positive and which is beneficial for everyone, for humankind. We should try and for tricks and techniques where there is a maximum reach, because at the end of the day your intention is to save people, right? So that should be done. That should be, you can definitely try and
Actually, that is a very positive suggestion. So that's why when I started this channel and I saw that the reach is on YouTube gives you analytics. You can evaluate your own video, how it's spreading, to what audience it's reaching, what are the sources that you're getting the views from. So I saw a lot of videos and did a lot of research on the YouTube algorithm. Why a video is promoted by YouTube or sent to a particular community. So so I am already doing it in a positive sense. Means I am studying what kind of metadata I should give to my video, the title, the tags, and the thumbnails, etc. So I'm already doing that, and I'm trying to, like I said, keep the entertainment part so that the outreach increases. But yes, clickbaits is something which slightly you are treading towards the, I would say maybe the unethical or the wrong trick.
yeah.
Yeah. So, and YouTube also doesn't like that. Eventually, your channel gets messages and copyright claims or misleading content stamps. So even it is not allowed legally. Even that will not sustain long, and such things don't sustain long. People learn that okay, this is a clickbait. Thumbnail is something else. Channel is something else. So maybe yes. So I think there are more questions creeping in, so we can take them.
Yeah, so there is one question where the question is, what is your take on homeopathy? Many allopathic doctors claim it's non-scientific.
Completely scientific. The In fact, Germany, I just learned yesterday that Germany has started its own homeopathy department in the Ministry of Health and Welfare, and they are planning to promote it to a huge level after learning of its benefit in this pandemic, both homeopathy and Ayurveda. But so both pathies are completely authentic as far as, but problem is that why these pathies are not coming up to the front, because one, sometimes they might not have instant dramatic relief. They might not be as gratifying as allopathy as instant. Second is research is very difficult in these departments. In fact, I'll just share an example. One of my homeopathy consultants approached the research departments and said that I have very good treatments for 10 diseases for which allopathy has no cure. Those patients are suffering, taking painkillers which are causing complications. Why not do a research, head-on research on allopathy versus homeopathic medicines for those treatments? He said, because your pathy is not right now supported according to the so-called modern medicine, so we can do that research, but if the patient gets some complication, you will have to fund the treatment of that complication, because we will assume that it is your homeopathic drug that is causing that complication. And the definition of this complication is very vague. So even if the patient gets an accident and gets a fracture, you will, a question may be asked that your medicine caused some drowsiness and the patient underwent an accident. You cannot prove that it was the patient who got an accident just by luck. So it is so difficult to undergo research for such pathies which are not right now in the definition of modern medicine. That's why they are not able to prove themselves, but they are definitely authentic and very scientific things going on. We have seen personal experience of thousands of patients, and of course, we are, in spite of these problems, we are limitations, we are still coming up with research for all these fields. We just came out with a research for benefit of homeopathy and Ayurveda in two different trials for corona patients, and we found a huge difference in patients who were taking Ayurvedic or homeopathic drugs along with the allopathic drugs. The almost to the extent that if a patient taking allopathic medicines was getting RT-PCR negative by 3 weeks free of corona, the person who was supporting it with homeopathy or Ayurveda was getting free in almost 48 hours. So such a huge difference. And we did it in all kinds of patients, those with mild illness, moderate illness, even the severe illnesses in ICUs. And the research is government registered and it will be out soon. So, of course, these are scientific and authentic pathies, and you should avail them, especially when you don't have an answer. In fact, we just launched a camp for pain management with Ayurveda. I was shocked to see that Ayurvedic people have a treatment called Agni Karma. They use some metals and burn it up and put it on points for your shoulders or your joints where you have pain, which is not getting treated by allopathy. And I saw changes within minutes. So, uh, 3 patients I saw who had frozen shoulder who were being treated for the past 4 years with so much pain, almost no change in their lifestyle despite thousands of drugs. Just into one session of Ayurveda Agni Karma, they got completely cured. So that was a huge shocker to me. And so these pathies are authentic. They just need to be approached more.
Yeah, and there need to be more and more people using it, and then there'll be a
Yeah.
of trust coming in. So there's one more
Yes.
question which says, please mention about the various diseases. Those can be dramatically treated with interventional radiology.
So we can take it up in, we can divide it by body parts. So uh, above the neck, especially the brain and the face, there are two kinds of diseases that can be treated. One is stroke. If it's a bleed, a hemorrhagic stroke where a blood vessel ruptures in the brains and starts bleeding, we can go in with this route that we talked about, the minimally invasive route through the wrist maybe, and put in coils in that blood vessel that is bleeding, knock it off, close it, and stop the bleeding so that the patient survives and he gets a shot at life. For clots like ischemic strokes, like the patients we have been talking about, we can go in with special devices which can suck the clot out. They are special aspiration catheters, or different devices like stent retrievers where we can go in and stick the clot to a metallic device and bring it out. So the patient who would have likely ended up with a major stroke gets cured and he gets a functional brain with minimal damage. So if we come to the neck, there are patients with blockages in the neck blood vessels like there are in the heart. Same cholesterol can deposit in the neck and cause strokes later on. So if we find these, and this can be very easily assessed and managed with Dopplers, just a small ultrasound can tell you that your neck vessel, especially if you're a diabetic, hypertensive, above 40, you can just get a small neck Doppler done, ultrasound or a sonography, and you will come to know that there is a blockage in your blood vessel, and if it is there, interventional radiologist can go in and put a stent and just open up that blood vessel, that blockage, so that you don't have any future risk of stroke.
Yeah.
In the chest, if someone has TB and they are bleeding because of and they might die because of that bleeding, because of TB or cancer or anything, we can again just go in those blood vessels that are bleeding of the lungs, and we can stop them, embolize them, so that so anywhere there is bleeding in the body, anywhere there is a clot in the body, either in the legs where it's causing gangrene or the brain where it's causing a stroke, we can go in and remove those clots. Anywhere there is bleeding, we can go in and stop that bleeding and save a life. We can do biopsies in different locations where a surgeon cannot reach because they are too deep, just with a small needle and imaging guidance. So, and we can treat cancers. So these are the 4 places where, for either to diagnose or to save the patient. For cancers, what we do is usually chemotherapy may not reach the cancer effectively, and even if it does, it also reaches the rest of the body cells and causes a lot of complications, side effects. But what we do is we enter the blood vessels of the cancer, and we inject the chemotherapy there. So most of it reaches the cancer and very less goes to rest of the body. So this is very specialized treatment, approved for a few cancers now and soon getting expanded for more. So we can treat that also. So all these treatments, bleeding, clots, cancers, and for diagnosis, biopsies, etc., it makes a huge difference in the patient's health.
These technologies, are they just I mean, out of curiosity, are they just there in the private hospitals, or this technology has come in government hospitals also, or it'll take some time to come in from private to government?
Come in the government hospitals. For example, in Mumbai, KEM, Sion, and JJ, all 3 hospitals have these technologies. But every hospital, it is evolving in different terms. A government hospital may offer the stroke therapy and the gangrene therapy, but may not have expertise for the fibroid embolization, which we talked about. So
Yeah.
again, it's like every interventional radiologist who goes to the government setup, and government setups also do not have right now sanction for the hardware of these kinds of treatment. So even if you go to a government hospital, you might have to pay for the hardware cost of these treatments, because the government is yet not completely updated about these therapies, and so they have not yet sanctioned the hardware of these therapies. So it might cost you some amount, at least maybe not the admission part or the operation part, but the hardware part you might have to cover. But it's expanding. It's, as we speak, every week it's expanding, and more government setups are getting these therapies, and the spectrum is also expanding in the government setups.
Yeah. So there's one more question, which says that how can a person detect any type of cancer early in life?
Broad question. It is addressed to both ma'am, yourself and me. I'll share my part and you can also add to it. So there are various ways of screening for cancer and detecting it early. Uh, so one is get a routine checkup done, maybe yearly, at least once yearly. And so which includes x-rays, ultrasounds to detect any kind of cancer in the chest or the bellies, which includes mammography for female patients, and which includes a lot of blood tests which are particularly cancer markers, like PSA for prostate cancers, CA99 for biliary cancers or liver cancers, and so on. So you can get a dedicated health checkup done yearly. Second is, if you know that your family member has had a cancer, then I would suggest you go to a genetic specialist, screen yourself and all your family members for mutations or for genetic defects which may be the cause of cancer in that person, and potentially which may come up again in you or your family member. So especially if you have had one or more people in your family have a cancer, visit a genetic screening specialist. And if you don't know where, so just visit a cancer hospital and ask about it. Like Mumbai Tata Hospital has a very good genetics department. Delhi Gangaram Hospital has a good genetics department, so on. So these are the 2 ways. If you don't have a high risk or a known risk of cancer in the family, just get a yearly annual checkup. And if you have someone, then get a special genetic screening done. Last thing, my suggestion is, if you notice any kind of symptom in your body, don't delay it. If you notice jaundice, don't just get treated by these local non-doctor pathies, which will do some brooming or something and help you with jaundice. Go to a doctor. It might be cancer. Jaundice can even be cancer. So biliary cancer, bile duct cancer. So don't ignore symptoms and don't get a good authentic opinion of a doctor and get it checked up. So these are the three advices I can give. Ma'am has just mentioned that she herself had to face
Well, I,
something.
since I am not a doctor, but I can just give you an experience. When my dad was detected with cancer, I mean, the whole thing just started with a very normal symptom. And very honestly, since this is like for the first time that has happened in my entire family, a distant family as well. So this is like the first case. So none of us were even aware. Though my brother, he is into biomedical sciences and he does research on cancer in America, but even he couldn't foresee that it is actually a cancer. So with a normal symptom we thought, okay, it could be some normal random thing, maybe related to age or something like that. But then yes, that's what we did. We actually went to the doctor, we got him checked. Sadly, that too also took us like 2 to 3 months, because he was not ready, my dad was not ready to go and meet the doctor. I think that is also one very big inhibition which patients tend to have, or we as humans tend to have, that we feel that, oh, it is a normal thing and that we shouldn't get ourselves like a regular checkup kind of a thing. So that itself took like 3 months, it delayed by 3 months. So originally the first symptom had happened to him in May, and he got a checkup done in August. And it was by August when the first checkup was done and the reports that came out, and he was already in the fourth stage of GBM. And it was so immediate that we had to just rush him for a surgery. So the doctor said that you have to just rush him for a surgery in the next 1 week. Luckily, yeah, we were in the position to just go ahead with the surgery, and we did take a couple of opinions. But when their surgery has to be done, so we just trusted the doctor and we just went ahead with it. So that was my second thing. So I mean, coming in from a non-medical background and experiencing cancer in my family, I would say first thing is that yes, do not delay. The lifestyles that we are living in today definitely needs a regular checkup on a yearly basis, and that should not be taken for granted. And second thing is that if something has been detected already, so it is very important that we trust the doctor. And I think that's what you're doing. So if you do not trust the doctor and you just waste in your time, like I remember, at that point of time, if I would have just gone to like some another 25 doctors asking in for opinions, it would have already messed the case further. So we just took whatever the doctor said at that point of time, we took his advice and we just went ahead. So yeah, the trust is also very important. So these two things are very important to detect any kind of cancer. And I don't think it's just about cancer, it is about any disease, right? Trust is very important, and a regular health checkup is very important. So these are the two advices coming in from my side. Yeah, and the third advice is stop Google. Do not Google. Because Googling is just, it just makes your brain crazy. It might be a smallest thing, but at the end of the day, it will turn out as a cancer. So Googling is no point Googling. The best is, yeah, you should go to a doctor, to an expert, and ask his advice or her advice. So these are my suggestions. Taking in, there is one more question which says, how is IR useful for varicose veins?
Varicose veins, yes.
Yeah.
We covered a few diseases like cancer, bleeding, clots to Dr. Pisal sir's question.
Yeah.
There are few diseases which are not really deadly or bad, but they are very life limiting. They cause so much problem, so much morbidity that your quality of life affects a lot. One of them is prostate problems, prostatic hypertrophy, which almost 9 out of 10 males will face after the age of 60. They won't be able to pass urine without pain, without pressure symptoms. They have to get up in night almost 10 times. Second is fibroids, which we have already discussed. And one of these problems is this varicose veins, where few veins of the legs swell up and the blood in them does not pump back to the heart and it gets static. It collects there and eventually starts secreting because it's there, it starts secreting toxins and starts damaging your skin and your leg, causing leg swelling and a lot of problems. So yes, so the old treatment for this was just to do a surgery and strip the whole vein out. These are not important veins, but when they get diseased, they harm you. So you just strip it whole out with a hook, and it leaves a scar. It's bad, and it has a very huge chance of recurrence because you are stripping out the main vein, but there are thousands of small channels that are there.
Yeah.
The alternative to that has come in the form of interventional minimally invasive therapy, where we take in a small tube inside these veins with a small pinhole again, and that tube is connected to a laser machine, and we just switch on the machine and the tube creates thermal heat because of the laser current, and it starts burning the vein from within, and the vein just burns up and shrinks. And even if there are thousands of small channels which are still there, we can just inject a small detergent agent in them, mixed with air. So we create a foam and we inject in those thousands of channels and we burn them also chemically. So this is a very novel treatment, laser ablation and foam sclerotherapy. And this is what, so it completely cures the patient and the patient can live a life with a lot of better quality. Just since we touched upon these topics, and there is a question by Dr. Pisal sir again, please highlight IR help for benign prostatic hypertrophy, which again, like I said, above 60, the prostate starts increasing in size and causing urinary symptoms. So, like for fibroid, we do the same thing. We just we take a small catheter from the wrist, small tube, small wire into the blood vessels that are feeding the prostates, the prostatic arteries, and we block them off with particles. And once the blood supply to the prostate is gone, the prostate starts shrinking. And whatever pressure it was exerting on the urine pipe, the urethra, because of which a patient wasn't able to pass urine and had to apply pressure, that goes off because now that pressure has gone away. The prostate that was pressing upon the urine pipe has gone away, has shrunk. So the patient is able to pass urine with a lot more ease, and the quality of life increases. So yeah, so this is one therapy where patients, the other alternative to that conventional alternative was surgery. Patient had to go undergo a surgery where the prostate was shaved off and removed through the endoscopic route by a camera. But this is a minimally invasive alternative. By just a small pinhole in the wrist, we can do this. So it's known as prostatic artery embolization. I'll be coming out on a video on that too, sir, on the channel.
Yeah,
So
you should,
you
you
can.
should. That was really interesting. I mean, there's so much to learn. Now that I am conducting weekly sessions, and from the whole medical fraternity, I get to know so many things. So the initiative that you've been doing, it's really wonderful, and I wish you all the best. Yes, so yeah, so this is like a suggestion which says a video on IBS. I'm not very sure what an IBS is, but yeah, that's a suggestion to you, doctor. Please
There are
do make.
two, yes, yes, there are two terms IBS. One is the inflammatory bowel syndrome, one is the irritable bowel syndrome. The more
Yeah.
common usage of the term is for irritable bowel syndrome, where a person can have alternate constipations and loose motions or diarrhea. So, because his bowel is irritable. Uh, yes, thank you, Mr. Abhimanyu, for that question. I'll definitely come out a video on that. Right now, I'll suggest you that allopathy does not have much tangible answers for that. We do give medications which can control it a bit, but does not really cure it. So for this is one thing where I'll urge you to approach either Ayurved for or naturopathist for this. Even better is just try intermittent fasting. There is a famous channel on YouTube, Sattvic Movement by Subha Jain. I have been following this movement, and it's a very simple. It gives a very simple outline based on intermittent fasting, which is a very natural thing to do, and it can cure you of all of your diseases, especially bowel diseases. So for IBS, I will urge you to just visit that channel, try it out for 21 days. You will be, if anyone you know is suffering with this disease, you will get cured of it. So I'm very sure of that. I've tried it for many things in my life. I've seen live testimonials of patients doing it and they are getting cured without needing to take any pathy or any treatment. It's a very good initiative. So try to see that, and it will definitely help. I'll make a video on it soon. After I finish my IR range and after I finish a few other specialties, when I come to gastroenterology, I'll definitely make a video on it because many people are suffering from it. They don't know the cause of it, and they don't have tangible therapy in allopathy. So I understand the concern. I'll definitely try.
Great. Just to add on, even I did intermittent fasting. I mean, I didn't do it with any intention, just to reduce weight. That was my intention. All right. I mean, yeah. If you have more questions, I'm sure you can just put in your questions to us, and we can direct it as a question. I want to know about lipoma.
lipoma is nothing but a small tumor of fat. It's made up of fat, completely made up of fat. So it is a benign tumor or a benign growth which can occur anywhere in the body. Lipomas can occur in the shoulders, in the muscles, in the skin, in the subcutaneous tissue. It can occur in any organ, in the liver, in the adrenal glands, kidney, and so on. So most of lipomas do not require any kind of treatment, and they are benign. They are never going to turn cancerous. That being said, you can just consult a doctor and keep it under vision. Maybe once yearly you can just get an ultrasound or investigation done, because few areas it can turn into cancer. It can turn into a liposarcoma. So you can just talk to your doctor and know what is the risk of my lipoma turning into a liposarcoma, and do I need to follow it up, or I can forget about it. And sometimes even if it doesn't turn into cancer, but it is disturbing you in sense that, you know, let's say it's on the thigh and every time you sit it's hurting you, you can get it removed. It's a very simple thing to do. Just a small nick and a surgeon can remove it with not a big scar, not a big surgery, maybe under local anesthesia too. So it's a very small thing, but approach a surgeon or a doctor and just talk to him. If it's, how much is it disturbing you and what are the chances of cancer in that. If the chances are negligible and it's not disturbing you, you can let it remain for life. Maybe take a look at it through some ultrasound or sonography every 2 years or so, and then forget about it.
Wow, great, great. Thanks for answering that. We'll be ending the session, and Dr. Gaurav, thank you so much. We'll be posting your videos. In fact, you should be posting your videos on our KLeFT group, as well as you can also post in your page, the Facebook page that you are having about your channel. But do post it on our KLeFT group, and then we will take it there, and we'll increase the reach if we whatever we have, and probably from my page and from Dr. Kirti's page, and subscribe for Dr. Gaurav's channel. Thank you once again, Dr. Gaurav. Anything else that you would want to say as your closing statements?
I just wanted to thank you, Mrs. Rathod, Dr. Kirti Gehlot ma'am. I have been knowing her through a group, radiology group, where we used to exchange academic information, and it is so good to know that about this side of your life. So when you say that I'm, by profession I'm doing a particular thing, but by passion I'm a humanitarian, it actually means a lot. So such a good initiative. I mean, I don't see anything in this venture where I can think of something that is of personal interest to you. It is actually, I can see this as an initiative which you have come out for the community, for giving,
Yeah,
contributing to the society.
definitely.
And I was just hearing, yes, I was just hearing about balance in life, and I heard that there are 5 things which you need to balance: your health, your family and friends, your spirituality, your profession, and the fifth is your community. And that motivational speaker was saying that if you don't add anything to your community, so you're not balanced really, even if all 4 other aspects are good.
Yeah,
So thank you for showing me how important is to do something out of your way, out of your profession, out of your regular family life, and add to the community. So such a good venture. I'm very grateful to both of you. And I think everybody who is joining in regularly and even occasionally is seeing that. You can understand by the vibes that the kind of attitude that both of you have and the entire team has. I'm very grateful to Yash Gehlot, Mr. Yash Gehlot, for supporting in the technical terms and other things.
yeah,
So, and thank you for the audience. It's not easy to be logged in for more than an hour just for an educational purpose. So, thank you everyone for coming in and encouraging and then being so interactive with questions, especially esteemed members like Dr. Pishal sir. I mean, he is himself such an inspiration, and him coming in and talking, giving his time, being interactive. So, thank you. Just very grateful after the. Actually, I'm inspired to go back and create more, add more. Thank you,
Wow,
Mrs.
thank you so much. I mean, that really inspires us, because at the end of the day, me and Dr. Kirti, that is our aim, and that is the reason why we've started this entire group, where we want to bring in those people who are actually making in an effort to, change, or bring like a positive change in the community. Because every day, here and there, and especially now when the pandemic has actually happened, so it's like an eye opener that okay, उठो, कुछ करो, अभी नहीं किया तो फिर कुछ नहीं कर पाओगे. So that's an initiative from us, where we want to bring in all those people who are making an effort and bring them to this platform and give them the maximum reach that is possible. Thank you everyone again for tuning in and staying with us on a Sunday evening. Have a great Sunday evening. We're signing off from here, and thank you, Gaurav. We'll also subscribe to your channel. All right. Yeah. Bye-bye.